So today I'd like to talk to you about your current diagnosis of a pulmonary embolism. Do you speak English and understand it well?
Yes.
Alright, so a pulmonary embolism is a sudden blockage of a major blood vessel in the lung. According to the Critical Care Nurse Journal, the thrombus causes a blockage in the lung, resulting in an increase in pulmonary pressure, which increases the resistance to blood flow in the right ventricle chamber in the heart. The result is increased right ventricular workload and decreased blood flow to the lung. If the right ventricle cannot pump against the increased pressure, right-sided heart failure can occur. Symptoms of which can be sudden shortness of breath, a sharp sudden pain that gets worse when you cough or take a deep breath. You also can get hypotension or low oxygen, which is hypoxemia. According to drugs.com, other symptoms can include feeling anxious or on the edge, you sweat a lot, feel lightheaded or faint, or you have a sudden fast pulse or heart rate. The normal causes of this, which occur from a DVT, are deep vein thrombosis, which means there was a blood clot in your leg that broke off and made its way into one of the arteries in your lungs and lodged itself, causing the blockage. Increased risk factors are being inactive for long periods of time, recent surgery that involves the legs, hip, belly, or brain, some diseases such as cancer, heart failure, and a stroke. Pregnancy and childbirth also increase these risks, but especially having a C-section. Birth control pills also cause a high risk, along with smoking, all from the Mayo Clinic. In your case, a piece of the tumor from your lung cancer broke off and made its way into an artery in your lung and lodged itself, causing the blockage. According to WebMD, the diagnosis can be based off a history of risk factors and symptoms, but we can do tests to verify. We can do an EKG, which we hook you up to lead cords. We look for any sign of strain on the heart that can occur with a pulmonary embolism. It can also look for any abnormal heart rhythms, such as atrial fibrillation, which is the result of a pulmonary embolism. There are also blood tests we can perform. We have the ABGs, which is arterial blood gas. This test checks the level of oxygen in the blood, telling us if it's low or high. We can also do a chest x-ray. We can do a CT scan, where we give you some dye and we look for some clots in the lungs. We can do a lung ventilation perfusion scan, or a VQ scan. This uses a radioactive substance to show how well oxygen blood are flowing into all areas of the lungs. Another and final test we could possibly do was a pulmonary angiography, which is where we insert a flexible tube called a catheter into your arm or through the groin, and we have it follow into a blood vessel into the lungs. Then we inject dye through the catheter into the blood vessels, and we use our x-ray machine and take pictures to show how the blood is flowing through the vessels into the lungs. Do you understand so far?
Yes, I do.
Okay. So we have our medical therapies and we have our nursing therapies. For medical therapy, we have an anticoagulant therapy, which anticoagulants are blood thinners, and they do not dissolve the clots, but they prevent further clots from forming. They prevent the size of current clots from growing. According to the Texas Heart Institute Journal, we can also do an embolectomy, which is a rare surgical treatment. Basically, it's for people who can't wait for blood thinners to work effectively, and we have to go in and surgically remove the blood clot. We also have our nursing therapies, where we can use SCDs, which are sleeves that go around your legs. They inflate and deflate throughout the day several times, and they increase blood flow and they decrease the likelihood that you'll get another blood clot while you're not walking around and being as active as you normally are on a daily basis. We have compression stockings. They're a little bit more active. They're not hooked up to a machine that inflate or deflate, but you put them on in the morning before you get out of bed, and they decrease the swelling, improve circulation, and prevent clotting. We can also apply oxygen if your arterial blood gas is low and you're hypoxic. We want to evaluate what your oxygen is and increase your O2 stats. For your anticoagulant therapy, we have Coumadin, Arixtra, and Lovenox. Those do not have pork extracts in it since it's against your religion with heparin. For the Coumadin, it's also called warfarin. It starts to take effect 3 to 5 days after you start taking it. So we normally have a bridge. We'll use Lovenox first since it's a quicker acting anticoagulant and move you towards the Coumadin depending on your INR. The purpose is for blood clots and to reduce formation of newer blood clots. According to drugs.com, the side effects include bleeding gums, bloody stool, nosebleeds, excessive bruising, tiredness, weakness, or headaches. So the usual dosage, it depends on your PT-INR, which changes on a daily basis. But generally you take 1 pill daily around 5 or 6 o'clock at night, and you take it with food. The basic target INR is 2.5, but a range is 2.3 to 3.0, which is good. If you have less than 2.0 and you're around maybe 1.0, you're at risk for making clots. And above 3, you're at risk for not making clots, and your blood's really thin and you could bleed. So when you go home, you're going to get your INRs checked every 2 to 6 weeks. Symptoms to notify your provider: you're vomiting, coughing up blood, red or dark brown urine, red, black, tarry stool, unusual bleeding, headache, or stomach ache. And you can also have excessive bleeding or bruising. So when you have too little warfarin and you have a low INR, you're going to get new numbness or tingling, new visual changes or loss in sight, sudden onset of slurred speech or inability to speak, new dizziness, faintness, new pain, swelling, redness, shortness of breath, or chest pain. This does interact with other meds. Over-the-counter meds, herbs, and vitamin supplements should be consulted with your doctor. And you should not take this with aspirin or ibuprofen, which is things like Excedrin, Advil, Motrin, Bayer, or NyQuil. If you have too much in it, you could internally bleed. People on blood thinners have routine INRs checked to make sure that the blood is able to clot. Call your doctor right away if you're noticing you're bruising easily or bleeding excessively. Another group of meds was anti-nausea. There's Phenergan, Compazine, or Zofran. Phenergan is used for nausea and vomiting. Symptoms are drowsiness, constipation, blurred vision, and dry mouth. Side effects: the side effects from getting up too quickly and from a sitting or lying position may cause you to feel dizzy. Avoid drinking, driving, exposure to sunlight. The usual dosage is 12.5 to 25 milligrams every 4 to 6 hours. Symptoms to notify your provider: twitching or uncontrollable movements of your eyes, lips, tongue, face, arms, and legs. You have hallucinations, change in mood, abdominal pain, yelling of skin or eyes. Another group of meds would be for pain management. We have morphine, Dilaudid, and Percocets. Percocet is made up of acetaminophen and oxycodone. The usual dosages for an adult is 2.5 milligrams and 325 milligrams of acetaminophen. You take 2 tabs every 6 hours. Side effects include nausea, vomiting, and constipation. you should take things like milk of magnesia to reduce the constipation. For symptoms to notify your doctor: mental or mood change, seizures, difficulty urinating, severe stomach or abdominal pain. So, to help with these, we need to do lifestyle changes. You need to be careful of getting cuts. When you're on blood thinners, you don't clot as well, so you bleed for a little bit longer. So you need to be careful of that. Be more active. I know you walk to church, but you also need to do exercise each day. It's recommended for everyone for 30 minutes each day. But you can walk, you can bike ride, you can go swimming. And since you smoke a pack of cigarettes a day, the ideal goal would maybe to be quit smoking. But if we can cut back for a start, that would be good. But that is going to increase your likelihood for getting more clots. You should really wear the compression socks. You should put them on before you get out of bed, before your feet touch the ground. They need to be elevated. And that's about it. Do you understand the disease and treatments?
Yes, I do.
Do you have any questions?
No, I do not.
Do you have any questions about the tests, procedures, paperwork, following instructions? Anything?
No, you explained it all very well. Thank you.
You're welcome.